Governor, with the public option. Is that a red line for Republicans? If there's a public option in this plan, should Republicans reject it?
Yeah, of course they should. Look, let's start off from the very beginning, which is Republicans recognize that have said for a long time we've got problems in health care. We need health care reform. And, you know, we took that on in Massachusetts. We decided we wanted to get everybody insured. We've done that. I understand that the president considers his plan in some respects following the model of Massachusetts. Let's learn from our experience. And that is, we got everybody in our state insured. Some 98% now are covered by insurance, and we did not have to put in place a government plan. We have competition in the health insurance market. There are hundreds of health insurance companies that all compete with each other. We don't need to have the government get in and create a health insurance company in order to have competition. We've already got it. And let's be clear here, George. This is not about getting competition in health insurance, which is already there. This is instead a Trojan horse. Barack Obama, when he ran for office, said he's in favor of a single-payer system. He said it for years. This is a way of getting government into the insurance business so they can take over health care. It's the wrong way to go, and every single Republican and every thinking Democrat who knows something about the private sector would realize the wrong thing for America is to get government into the health care business.
Except, Governor, you did bring up the Massachusetts plan, and you're exactly right. And most studies have shown that Massachusetts has done a very good job of expanding coverage with this plan, but has not done as good a job of controlling costs, and some say that's because of the absence of a public plan. Alan Sager, professor of health policy at Boston University, has said that health spending per person in Massachusetts has increased faster than the national average in 7 of the last 8 years.
Massachusetts is an expensive state to do a lot of things, but the key thing I can tell you is this. What's happened to the health insurance premium for people buying insurance in Massachusetts? It's been cut in half. For an individual, a young male, let's say 35 years old, buying insurance in Massachusetts for themselves, the premium has been cut in half since our plan went in place. So the cost of buying insurance is down, and that's the course that you have to have for the nation. Look, the idea that you have to get government into an enterprise in order for that to become competitive makes no sense at all. If it made sense, we'd have a government trucking company, a government automobile company, a government clothing company, a government farm company. That just is the wrong way to go. We can get our private industry to create better products and better services. That's what's happened throughout our economy. It's what's driven our economy to be the most powerful in the world. We do not need government in the health market.
It has worked for Medicare. It has worked for Veterans Care, hasn't it?
Oh, it's worked terribly. I mean, look at something like Medicaid. When Lyndon Johnson signed Medicaid, he said this is going to cost about $500 million a year. Now it costs $500 billion a year, 1,000 times more. Now, I realize there's been some inflation, but not that much. The wrong way to go is to get government into an entity in our economy as large as healthcare and expect anything to occur besides a Trojan horse effect of a single-payer system crowding out the private markets. It would be terrible for hospitals, awful for doctors, and ultimately it would be a disaster for the people in America because they wouldn't be able to choose private plans.
Well, I actually said Medicare, not Medicaid, and a lot of experts believe that Medicare has helped eliminate poverty among the elderly. But I want to move on.